It is indeed an honor and privilege to be present at the Amukare Charitable Trust annual function today. I understand that Amukare Charitable Trust and its sister organization, Amukare Charitable Trust Foundation, are known for their community and charity work. They are involved across many countries in providing services for the poor and needy children. Today's function is in support of children with autism and the care of autistic children in India. Experts estimate that 2 to 6 children out of every 1,000 have autism. The prevalence rate of autism in India is said to be around 1 in 250, and it is estimated that currently 10 million people are suffering in India. It is believed that autism presents itself during the first 3 years of child's life, with boys being at a higher risk than girls. Autism is complex developmental disability and is the result of neurological disorder that has an effect on normal brain function, affecting development of the child's communication and social interaction skills. Autism is a wide spectrum disorder known as autism spectrum disorder, or ASD. This means that no two children with autism will have exactly the same symptoms. Some children will have mild symptoms while others will have severe symptoms. So how does one go about recognizing a child, autistic child, in the early infancy or childhood? Failure to meet any of the following milestones in a child is an absolute indication for further investigations. These are a steady decline in attention to others' eyes within the first 2 months to 6 months, no babbling by 12 months, no gesturing, pointing, waving, etc. by 12 months, no single words by 16 months, no two-word phrases by 24 months. Any loss of any language or social skills at any age would give an indication as to this could be an autistic child, and investigation should be carried out. So what are the most common characteristics found in a child with ASD? Development of speech of impaired is one of them. About a third of half of autistic children do not develop enough natural speech to meet their daily communication needs. They also tend to start speaking later than other children and may refer to themselves by name instead of I or me. Children with autism will often repeat words or phrases they hear, which is called as echolalia. The speech of a person with ASD may sound much more formal and woody or without emotions compared to other children's speech. Some speak in a sing-song voice about a narrow range of favorite topics with little regard for interests for the person to whom they are speaking. The higher the severity of autism, the more affected is the child's speaking skills. Many children with ASD do not speak at all. The other characteristics is the response to physical contact. Children with an ASD do not like cuddling or being touched like other children do. But it is wrong to say that all children with autism are like that. Many will hug a relative, usually the mother, father, grandfather, grandmother, teacher or siblings, and enjoy it greatly. Often it is a question of practice and anticipating the physical contact that is going to happen. The third characteristics is the response to loud noises, smells, and lights. A child with autism usually finds sudden loud noises unpleasant and quite shocking. The same can happen with some smells and sudden changes in the intensity of lighting and ambient temperature. Many believe it is not so much the actual noise, smell, or light, but rather the surprise, but not being able to prepare for it, similar to the response to surprising physical contact. Another characteristic is the repetitive behavior in an ASD child. Many children with an ASD engage in repetitive movements such as rocking, twirling, or in self-abusive behavior such as biting or head banging. A child with autism likes predictability, routine in his or her best friend, going through the motions again and again is very much part of his or her life. To others, these repetitive behaviors may seem like a bizarre rites. Another characteristic is the impaired social interactions. The hallmark feature of ASD is impaired social interaction. An early infancy, a baby with ASD may be unresponsive to people or focus intently on one item to the exclusion of others for long periods of time. A child with an ASD will interact differently socially with other children as compared to a normal child. If the symptoms are not severe, the child with ASD may appear socially clumsy, sometimes seemingly offensive in his or her comments, and out of sync with the speech or activity of other children. Children with an ASD do not know how to play interactively with other children. Another important characteristic of an ASD child is the lack of awareness of other person's feeling. Children with ASD fail to respond to their names and often avoid eye contact with other people. They have difficulty interpreting with what others are thinking or feeling because they cannot understand social cues, such as tone of voice or facial expressions, and don't watch other people's faces for clues about appropriate behavior. They may lack empathy. A child with autism will find it much harder to understand the feelings of other children. His or her ability to instinctively empathize with others is much weaker than normal children. So how do you go about diagnosing this kind of a child? The diagnosis is mostly based on behavior of the child. Onset must be prior to the age of 3 years. Autism is defined as exhibiting at least 6 symptoms total, including at least 2 symptoms of qualitative impairment in social interaction, at least 1 symptom of qualitative impairment in communication, and at least 1 symptom of restricted and repetitive behavior. What is the treatment? The main goals of treating children with autism is to lessen associated deficits and family distress and to increase quality of life and functional independence. No single treatment is best, and treatment is typically tailored to child's needs. Therapies and behavioral interventions are designed to remedy specific symptoms and can bring about substantial improvement. Educational behavioral interventions. Therapists use highly structured and intensive skill-oriented training sessions such as applied behavior analysis to help children develop socially and develop language skills. Family counseling for the parents and siblings of children with an ASD often helps families cope with particular challenge of living with a child with an ASD. Medications. Doctors may prescribe medications for treatment of specific autism-related symptoms such as anxiety, depression, or obsessive compulsory disorder. Antipsychotic medications are used to treat severe behavioral problems. Seizures, if present, can be treated with 1 or more anticonvulsant drugs. There are a number of controversial therapies or interventions available, but few, if any, are supported by scientific studies. So what is the prognosis for an ASD? There is no known cure for ASD. Some children, however, recover spontaneously, occasionally, so they are no longer classified as ASD. This occurs sometimes after intensive treatment also. Not many children with autism live independently after reaching adulthood, though some become socially successful. I would like to quote an eminent environmentalist on a young child, and especially If a child is to keep alive his inborn sense of wonder, he needs the companionship of at least one adult who can share it, rediscovering with him the joy, excitement, and mystery of the world we live in. So this is extremely important for an ASD child. One parent or one adult sharing with him or her the inborn sense of wonder that a child would be needing it. Thank you very much.